All right, it's 4:01. Let's go ahead and get the party started. So we have about 351 people that have signed on now. I'm sure that some more will be coming. So I'll go ahead and get started and give an overview of what we're going to do today while some other folks log on. And then we'll go ahead and get started with the updates for you. So thank you all for being here with us today. For those of you who don't know me, my name is Joanne Kantner. I'm President Hushman's Chief of Staff. I'll be serving as the moderator for today's discussion. So the purpose of our discussion today is to be able to provide to the employees an update on our pandemic-related response and where we are as a university. We'll be doing another one tomorrow for the Glassboro residents, and then we have a similar WebEx planned on Thursday for students. So this one is specifically for the employees. And we want to talk about where we are, some of the numbers, our testing protocols, things like that. So what we're going to do today is hear from the individuals that you see in front of you. They'll each be giving an academic on their area. So first we're going to have Provost Lowman, who's going to give an update on the academic plans. Then we're going to talk to Scott Woodside, the director of our Wellness Center, and he's going to again talk about testing strategies, the number of positive cases that we're seeing. We do want to make one note for everybody. We have received some questions in advance about the fact that what you see on the website right now is a little bit delayed. So we are aware of this issue with the Cascade program. So the numbers that you're going to hear from Scott today are going to be what he sees right now, and we're working diligently with IRT to make sure that the website is updated as well. So we are aware of that glitch and are working on it. After Scott gives us an update, Kevin Koett, our VP for Student Life and Dean of Students, will be talking about what's happening in student life. And then Mike Kantner, our AVP for Public Safety, is going to talk about building access and also talk about our coordinated response with the Glassboro PD and how we're handling things that are happening off campus. And then, of course, we also have Dean Reboli from our medical school in Camden, who is here to answer questions as well. Just to give you a brief overview of how the event's going to go. So what we're going to do is we're going to hear again the updates from the individuals in the order that I just described, and then we're going to do a Q&A. So we have received some questions in advance, and what we did was make sure that those questions get incorporated into the responses and the updates that you're going to hear from the individuals here. But you can also submit questions through this WebEx during the event. Please don't worry, you will not see them as an attendee, but all of us here as panelists can see the questions. And so I'll be marking them down, and I'm going to be getting to all the questions that I can after everybody has given their update. So we're going to do our best to get to all the questions, of course. If we don't, you are welcome to email us directly after the event. And so that's it. So let's go ahead and get started. Provost Lowman, would you like to give us an update, please?
Yes, it's good to be back in front of this group again. I think back to maybe the first time we did this, maybe as far back as June, and how uncertain and how crazy everything was. Certainly things are still crazy. There is some level of uncertainty, but I think our bounds are a lot more understandable. So for those of you, yes, we're back. We're back in operations. We're now in week 3 of classes, and we're working hard to continue to operate with providing the best experience we can for all of our students in, of course, a very safe fashion. So right now we're operating in, it's hard to get the exact number. We have about 20% of our classes have some face-to-face hybrid component to the classes. So we are seeing kids on campus, in the classrooms, in the labs, in the studios. And for those of you who are on campus and you take a walk around, it's not anywhere near what a normal semester is, but it's so good to see that campus life and campus interaction back again. Students are wearing masks everywhere you go. They tend to be doing a good job of social distancing, and really we're pleased with the start. Our plan is that if public health dictates and we can do it safely, we will try to bring back more classes and more face-to-face opportunities for our students. But again, it's going to be driven by public health. Now, certainly we're not going to carry this decision on indefinitely and suddenly say in November that we might bring classes back. I think if we've got to watch the next couple of weeks, and if we can bring them back in the next couple of weeks, safely, we will. But when we get at a certain point in the semester, we'll be at a point where it's probably best from a pedagogical standpoint to stay in the mode of delivery we are. But the next two folks you're going to hear from, Scott Woodside, Kevin Koett, they're giving us updates daily, sometimes multiple times daily on where things are going. And in consultation with public health, that's what's driving our decisions on everything we do. So I know there'll be maybe some questions on that. I'd rather save time with that, but I do want to talk about questions that keep coming up are now about the spring semester. Many faculty may have heard from either their chairs, heads, or deans directly. But right now, we're looking at what makes the most sense for operation into a spring semester. How can we deliver our content in the best, safest manner with still a lot of unknowns out there? You know, some of the things we learned with the start of this semester is that I think no matter what we do, when you bring people back to campus after a break, there are going to be cases. And we've seen our peer institutions and ourselves, I think we were able to track, trace, mitigate that initial surge, and then hopefully return back to plan. So we have that bit of information, I think, of what it's going to look like coming back in the winter. The other things we have to look at is what is the virus going to dictate in the winter? What are the health professionals going to tell us as we get into the winter? And what are the things we can do? So we are looking at alternate schedules for starting the spring semester, perhaps late, starting the semester in a totally online format and moving to a more face-to-face based learning, but we're not there yet. So right now, as we've collected ideas, thoughts, opinions from the colleges, we've gotten feedback from student groups on ideas, and right now, as we're running through a few different scenarios on how we think maybe the winter or spring semester will operate best. So we're not going to carry this out indefinitely. We're not going to carry this decision into December. Certainly, it's not going to be like the summer, waiting till the last minute and waiting for the last guidance to operate the campus. We think we'll have a decision on our format for the winter, or at least the schedule for the winter, or I should say spring semester, no later than the first week of October. From there may be some variances. Are we starting one way? Are we doing this? But I think we'll have our idea on what the schedule will be no later than the first week of October. So with that, I'll turn it over to the next group because I think they're going to be providing updates maybe that people are a little bit more interested in right now, and certainly I'll address any questions that come my way about the specifics.
Thank you, Provost Lowman. We appreciate it. Scott, can you give us an update, please, on health and safety?
Thank you, Joanne. Yep. So I want to touch on a few topics that I know are at the forefront of people's thoughts right now. You know, so the first thing I want to mention is regarding testing and what we're doing on campus. So as we've been saying all along, we're going to have a two-pronged strategy, and that's exactly what we're doing. So we're focusing on the symptomatic students and the testing there. We've operated Holly Bush now for a number of weeks and are testing anywhere between 10 and 20 students a day there, Monday through Friday. Many of our students are also getting tested off campus. We're fortunate in this area to have numerous resources off campus that students are testing, and if they go to Inspire, Inspire is working with us very closely and sending us information. Otherwise, they get reported to the state, and then we get notified through our strong channels we have with the local and state health department. We're also doing asymptomatic testing. So we've expanded our asymptomatic testing this week, and actually, as we speak, they're being collected at Holly Bush Pavilion right now. We're sending that off once a week. Right now, the rate of return there has been just around 4%. So we're pretty happy with that. The students that were positive from that asymptomatic surveillance were actually already at home, and they are finishing their isolation period at home when I called them with results. So we're going to continue to expand that and offer it to not only on campus but off campus. So that is going to be a good strategy for us going forward. In terms of what it means, you heard me mention already on and off campus isolation and quarantine. I do get those questions a lot. So students that are positive, that are actively positive, or have been told that they have a positive test, those are students that we isolate, meaning They are not to be on campus. So any student that we identify as having a positive result, we offer them their options, which are triad, preferably. We currently have 44 students in triad as we speak. It's not at the peak. At our peak, I think we were at 45 mid last week. So that is, as you can imagine, a fluid situation. Students are by and large happy with triad. I do understand that there's some questions that some students don't want to report because of triad, but honestly, we found quite the opposite. Students are relatively comfortable there. So we are doing well. We're holding strong with triad, and I can't thank the folks at Res Life enough, and Kevin Koett enough for that, because we are all times, day or night. If we get a call at 9 p.m., a student's living on campus with a roommate, we are escorting them to triad and helping support them. EMS is a huge help with that transport. Public safety is helping us, getting students, back to their residence after they're done with triad. So those teams, those groups that I just mentioned, are literally working tirelessly for the first 3 weeks of the semester, and I cannot thank them enough. I couldn't do this without them. So isolation is one thing, and then quarantine. Every known contact is asked to quarantine. We provide them with instructions on what that looks like. And typically the duration of a quarantine period is 14 days from exposure. So if you have a roommate who tests positive, your quarantine period starts that day. And as long as you don't develop symptoms, you're allowed to stay in your room for that quarantine period. Same thing with off campus. So if there's someone living in a house off campus, they're quarantined for 14 days from that last exposure to a confirmed case. Total active cases. So on campus, as of right now, we are managing 131 active cases. That means that within the past 10 days, we're made aware of a known case. Now that number is incredibly fluid, and it changes literally by the day. So that is the number that we're using to manage and trend how we are managing cases. And just to give you some perspective, in the height of last week, when we had the most known cases to me, we were somewhere around 175 active cases at that point. So all indications right now are those numbers are trending down. We do understand that we had a surge early last week, and that those numbers are trending down. So that's the number of active cases that we have. Now, it's going to be very different from the numbers that you see, because what we're posting online are historical. So you're seeing total cumulative numbers. So again, I urge you not to look at those numbers as something that is what we're taking action on. That is just historical data that we're looking at. So that's very important. And those numbers do change, to be honest with you. It is complex, the way that we're receiving data. We are getting data from self-reports from our professors, which is fantastic. Thank you so much. I get a lot of those questions. Should I be sending you this information? Right now, we created this pandemic operations center where Kevin and I are literally here every day, 12, 14 hours a day, sometimes just managing that information. We'd rather have that information than not. So if you're aware of a confirmed case, if a student emails you, send it to us, because worst case scenario, we just double check that against the information that we have. The second form of information comes from the state and local health department, which I can't thank them enough. I have had numerous conference calls with the state health department, just making sure they're aware of what we're doing. They actually are taking the lead from us in some respects. We defined that what on and off campus is, and they shared that information with other universities so they can track that similarly. They have been fantastic partners, and our local health department, I have a daily phone call with. So we are working as closely as possible with them to try and manage this. The total number of cases, so I was mentioning that you'll see on the total number of cases that we have known to us as of this morning that have been investigated and confirmed is 245. So that's from really mid-August. So we're using that August 25th as a start date, but really August 12th, I think, was the first known case that we had in that period. So that is the number that we have currently historically. But really the number that I'm focused on, I'm looking at, is that number of active cases that we're currently managing, which, as I mentioned, was 131. I mentioned the asymptomatic surveillance. The contact tracing program has been working. I can tell you we have some really dedicated people that are really helping with us manage what's going on right now. And they are calling day and night, giving students good information about how to respond, how to manage, really caring for them through this period. And I'm really grateful for them. We're all going to take a break at some point when this is all over. Maybe we can go on vacation together at some point once all the quarantines are lifted. But they're doing a fantastic job trying to keep up. So please, if you're aware of a student or you hear, hey, someone hasn't gotten a phone call, send us that email. We'll put it into our tracking process and we'll get them connected because we know we're not perfect, but please do your best to send us information if you know it. Yes, go ahead.
There's a couple of questions about the 4% figure that you gave out. Can you clarify what that is?
So that is the asymptomatic. So we purchased test kits through Accurate Labs, which is I guess unofficially known as the Rutgers lab. So we purchased them specifically for that. So students once a week, they're selected at random. So we selected, really this past week, we identified 200 students. We invited them to participate. We got, I think, just about 50 this week that we're sending off today. So we've been doing that for the past 3 weeks, and that's what that percentage comes from, that positive from that process.
Thank you.
Yep, and that's really, those are my big updates. Other than, I just want to thank you all. I know how stressful and difficult this is, and I know we're all struggling in some way, but, you know, I'm grateful for the team that we have here. You know, I mentioned many of them already, but grateful for them and helping us get through this. So I'm happy to answer questions at the end, and hopefully we can all get on the same page.
Wonderful. Thank you. Kevin, can you give us an update, please?
Yes, good afternoon. I certainly appreciate the time to be here this afternoon, and I did see a couple of questions. When Scott's referring to contact us, you can contact the Wellness Center through their email or the Dean of Students email or either of our personal emails, so that's a way to contact us. From a student life standpoint, we have 4,074 students that are living on campus with us right now. We know a lot of our students need to be here for lots of different reasons, and so we are doing our best to help those students, and I think Scott will tell you that the data is showing that students are doing fairly well on campus, but we do have 4,074 of those with us. Drew and his team and Kevin George and all of our staff and student activities are doing a great job with planning activities. We had a welcome week, we had orientations, we're doing those in person, socially distanced, but we're also doing those virtually in a lots of different areas. So we're trying to maintain that contact and trying to keep students engaged as much as possible, but certainly focused on safety and making sure we're being socially distanced, much like you are in the classrooms. As Scott said, we've got 44 students that are in Triad. I do want to share my true appreciation to my Res Learning team, Dining Services, Police, EMS, lots of people working 24/7 to help these students. If somebody calls at 3 o'clock in the morning, we're helping them. If they call at 3 o'clock in the afternoon, we're helping them as well. So really doing a very diligent job of trying to take care of those students and continue to work on a daily basis of how do we engage those students, how do we keep them connected. We certainly are calling them every day. We're helping them with getting their meals, but also trying to find ways to keep them engaged in other ways. So we're working on that process through lots of people, Joe Cardona, Joanne, Scott, Mike Kantner, lots of people working with our community engagement. We meet weekly with the city of Glassboro and their representatives, but we were very proactive to meet with landlords. When we brought students into residence halls, we gave them a bag that had a thermometer, it had a mask, it had some general supplies, some information. We've given those to landlords as well to give to students off campus. So we're trying to make sure we're connecting with all of our students, but we've got a process that anybody can use to go online. You can get that information on the Dean of Students webpage. Go online, report concerns. Our community members are doing that. Well, we're going out. I personally am going out. I know others are going out. Whether that's to address a specific concern or just to go out and knock on a door and say, hey, can I have a conversation with you? Can we talk about something that's been reported to us? So that's something that we're being very diligent about. Multiple meetings with landlords, meeting with students. We've met with the Greek community. We've met with the student athletes. We've met with student leaders to share with them what our expectations and what our concerns are. But we're investigating all those concerns. Everything that comes to us, I can promise you I'm looking at, and either myself or a member from my team are investigating those. And then the only other thing I would say, a couple of things, reporting concerns I shared, we have that online process. I've sent about 600 letters out to faculty members when students do report concerns to us, so we're trying to maintain that line of communication. And then the question was, what are we asking our students to do? And I think that's an important question. Whether a student is on or off campus, we're just asking them to be good citizens. Certainly we want them to report concerns. We don't want them to be nervous or scared. We know that they are. We know there's anxiety around this issue, but we want them to report concerns. We want to be able to help them the best we can. We want them to wear masks. We want them to be honest with us, just to be good citizens. We don't, we certainly don't want large parties, and to a large extent, we're not seeing those right now. They're paying attention to us. So I'm pretty proud of what our students are doing. I'm proud of what our staff is doing. Kudos to lots of people. Not enough time to acknowledge them all, but lots of good things happening. So happy to answer any questions that might come up.
Thank you. Mike, can you give us an update, please? You're on mute.
Can you hear me?
Yep.
Okay, sorry about that. That's twice today with my technology. Once again, I'll repeat myself if you weren't lip readers. Welcome. And just like Scott and Kevin had mentioned earlier, I want to update you on a few things from public safety and the Office of Emergency Management, but we are in a definite support role with student life and the Wellness Center. The Office of Emergency Management, two agencies, did activate what Scott mentioned earlier was a Pandemic Operations Center, which is a quick center where we have people in there so we can kind of collect this data, reach out to people, get the most accurate information as possible, and stay on top of things. And that goes everywhere from students on campus, off campus, coordination with the Glassboro Police Department, as well as the Glassboro Office of Emergency Management, and our other partners within this area here. Speaking of the Glassboro Police Department, our police department and the Glassboro Police Department have been working together on any off-campus situations that may have any large gatherings of students. Kevin alluded to this earlier, and I shall keep my fingers crossed, and I will touch the wood on my desk right now. But in my 11 years here, this is probably the first September that we really haven't had that many large parties. And I will continue to hopefully say that will continue. Not trying to jinx myself, say cross fingers, okay? But I want to believe that a message that were sent out before the semester and during the semester, and people are seeing that this is a serious situation we're in, and the maturity level is heightened where they're taking precautions. I would say, hey, not everybody's going to take precautions. We know that. Not even adults do. But we are doing a good job of working together with our partners to make sure that if anybody does have any issues, where anybody out of line, we'll report it right away. I will say this, in the times here, Kevin Koett has responded probably, I would say about maybe 5 times so far this semester in the middle of the night over the weekends on any issues with students. And he's been nipping it in the bud right away. So to use his word, kudos on that. Real quick, I want to open up the questions, but for the majority of the people in this room here that know that from March on, we have shut buildings down. And you were able to email me, and I made accommodations through public safety to grant you access or your employees access during our COVID shutdown of the building. Well, once the semester started, about a week before that, we did have access to certain buildings. So if anybody has any questions, please feel free to give me an email, give me a call. But as of right now, all the academic buildings are opened on a time schedule during the day. So everyone does have access. There's 3 other buildings, administrative buildings are still on lockdown, but there are 3 other buildings that are also on an open schedule, and they are Winans, the Wellness Center, they are our Student Center, and they are Savitz. So those buildings are open during the day. Also, 2 are after hours. Anybody who has access cards activated, which you should, and if you don't have them, you go directly through your chair or your dean, and we have what they call RIMS managers or RIMS owner list that these people have access to RIMS to give people the access that they need justifiably. So access situations has kind of dissipated a little bit from the beginning of the semester. And like I said, we'll continue to work along with every entity here and our outside partners. So I'm available to answer any questions like everyone else. But thank you for being here.
Thank you, Mike. I appreciate it. Annette, can you give a quick update on the role that the medical schools have been playing in our response?
So the role that the medical schools have been playing is multifold. Certainly participation by a variety of physicians, subject matter experts on the committees that Rowan has stood up, the Emergency Management Committee, the Metrics Committee, offering our expertise in epidemiology and infectious diseases. These meetings occur on a regular basis throughout the week. Other areas, both medical schools opened before the campuses reopened, the main campus in Glassboro. And so far, so good with regard to safety. Now, our school is opened in a hybrid fashion, as I believe SOM is. Whatever we could deliver remotely, we're doing remotely. The experiential portions for the 3rd and 4th year students have been going on now since July. And I'm very happy to say that with the safety measures put in place, that our students, our clinical faculty, our staff have all been very safe. Our school is associated with Cooper Hospital. Today, Cooper announced that they only had 6 cases totally within the whole hospital environment of COVID patients. So this is an all-time low that they've had. So the numbers are very good right now in southern New Jersey as far as the numbers of cases. We also see a bit of a shift. Now, this is encouraging that despite the Labor Day weekend, there was expected to be a probable uptick after the Labor Day weekend. But we had a slight increase, but not anything with seriously ill patients going to the hospital. So that 6 is a very good number. That's very, very low, very encouraging.
Thank you. I appreciate that, Annette. Scott, there's a lot of questions about testing. So can you describe, if you haven't thoroughly yet, talk about the types of testing that we're using, where testing can take place. There's a question about employee testing, if they can go to Holly Bush, things like that. Can you give us an update on testing, why we chose the protocol that we did?
Yeah, so the testing that we are using, it's a PCR level test at Holly Bush. So it is a nasal swab. LabCorp is one of our primary partners. Those of you that have heard me talk before, heard me mention about a rapid machine. We do have the rapid machine in our possession, but the reagents that we use for that is still to be shipped. They're promising hopefully by October. So they'll be the 2 main sources of testing that we'll have in addition to the asymptomatic process, which is the saliva test. So employees absolutely can't get tested there. We are using Rowan Medicine as a partner for that. So if an employee chooses to be tested on campus, they would call Rowan Medicine. That number is available on the Rowan Restart. I'll make sure that that's available to everybody. They could choose to do that. Many employees that have chosen to be tested have used some of the local resources. So I can tell you Rite Aid and CVS are 2 of the primary local pharmacies that offer testing, and many people have chosen to go that route. That information is available as well, and we'll make sure that we have that posted. I believe that's already been disseminated, but we'll make sure that information is posted. Was that most of the questions, Joanne?
I think so. And can you talk just a little bit? I know I mentioned it earlier about the fact that regarding the cases that we have right now, the active cases that you discussed earlier, and for those of you attending who missed it in the beginning, we are aware that there's a delay on the website and that it hasn't been updated since the 13th. IRT is working on that, so we just presented to you the current numbers, but we do know that there's a difference. There's a glitch with the Cascade program, and we are working on that. So I think that's one question. Can you talk a little bit, Scott, about the health metrics meetings, the kinds of metrics that we're looking at? You know.
Yep. So we meet 3 times a week formally, and probably a lot more than that informally, to discuss the metrics and updates that are going on. And we really, and they're probably tired of hearing me say this, we really start outside in. So we look at the hospital systems first. Right now in our command center, I'm looking at Jefferson and Spear numbers, which are incredibly low, similar to what Annette had just reported with Cooper. So they're incredibly low. The ventilator usage is incredibly low. ER visits are stable. That's one of the things I'm looking for in particular, because we know before the pandemic in March, when it really hit, ER visits took a huge spike. So we're looking at that ICU capacity. And then we look at county level data. County level data has seen a slight uptick over the past 2 weeks in Burlington, Camden, and Gloucester, and talking to colleagues across the state. While overall numbers are still about the same, their largest uptick is the 18 to 24 population. That is what we're seeing across the state in terms of numbers and increases. And then moving more into here, what we're looking at is our test results, what we have. We're looking at the asymptomatic testing. We're looking at the number of isolation and quarantine. So we share that data every day with where we are with the number of students that are in isolation quarantine, the number of students in triad. And we also look at the trending data. So thank you to all of you that do the daily screening, because we use that for trending. To see how many people come to campus, how many report symptoms. I can tell you if you've got an email from me, because you checked off by accident that you're symptomatic but still coming to campus, you've gotten an email there, and most people have checked it off by accident. So we're looking at those trends, and those are all to provide us the big picture as to when we need to shift. And we actually used that information last week when we collectively decided that we need to maintain this current mode of delivery and not expand any in-person activities on campus, whether in the classroom or in student activities. So that data is all very important, and we look at it nonstop. And it's a collective team effort, and it's important. And you should know that we're paying very close attention to all these numbers.
Thank you. Kevin, can you talk about what happens in quarantine? Perhaps you and Scott both can talk about that. There are a bunch of questions about things like, are the students getting food, and who is going into quarantine? We recently expanded that to students who are off campus who need to go as well. Can you talk a little bit about that? The process, what happens when they're there, when they get released, what kinds of instructions they're given. There's a lot of related questions on this.
Sure. We take our lead from the Wellness Center, so we'll get a notification that says a student needs to move to triad. Now, that could be for lots of different reasons, but certainly students have options of, do they want to do their quarantine or isolation off campus at home? Do they need on campus? So there are lots of conversations that happen before that gets to us. But once there's a referral made to triad, our residential learning team does an amazing job of connecting with the student. EMS has opportunities if a student needs help transporting belongings over to triad. They will assist with that. The police department helps as well of transporting students back from triad if they need that assistance. So we don't just say to a student, find your way to triad. We help them get there. There is daily contact with the student from the residential learning team. They make phone calls. They connect with students via text. They go over in person and have conversations with them. We work with the dining hall we have established times where, again, the on-call person will coordinate with the dining hall to deliver meals. Those meals are delivered in a socially distanced way that they'll be set on a table. The student then can come out and get their meals. Like I said, we certainly have communicated with students about the virtual activities that we have on campus to try to keep them engaged. So we connect with them on a daily basis. We work with the residential learning team to make sure they have what they need. The rooms have microwaves. They're cleaned thoroughly. So it's a pretty intense process, comprehensive process that a lot of people are engaged with, but we do stay connected with the students throughout their time.
So thank you. One of the questions that just came up was, should faculty proactively ask students to self-report positive tests, or must we wait for students to notify faculty, if at all?
No,
Joanne, can I add on that, Kevin? Because I want to do this because this is something that comes up to the provost's office quite a bit, and I know there's a lot of confusion about what happens from when a student reports to a faculty member that they're positive or have been in touch with positive. What do they do? What are they required to do? When do they know when to let people back into the classroom? That's it's probably a long answer, but I think you guys probably have it.
Mhm.
Yeah, so certainly anything that can be done proactively to encourage people to report, we want that to happen. We hope they hear that from everybody on campus. We need people to be honest with us. We need people to report. So in addition to helping with Triad, I send notifications out to faculty. The notice will say something to the effect of Kevin Koett cannot be in in-person classes until this date. There's a date listed on there, so that notifies the faculty member when the student is able to return to class, and then ask them, to work with the student, so not to be penalized for not being in person. Lots of questions, and I really appreciate them about, does that mean that the student can't participate in virtual? No, they should participate in virtual. Now, we know that there are some students who might not feel well enough, but then we're going to follow up with the absence notification process if a student is feeling sick or not feeling well enough to attend. So we do expect that our students, if they're feeling well and able to, we expect them to participate in virtual classes and online classes. So I'll let Scott talk about more of some of the other things that happen.
I mean, all I really want to add to that was very well said. All I want to add to that is it's important to let us know if any of your students let you know that they tested positive. And the reason is this: I mentioned briefly about the complications and the complexity of this information. One of the reasons why the state is very happy with what we're doing. They're certainly not happy that we have cases, but they're happy with what we're doing because we are being proactive and we are actively going out there and asking students to self-report, and we're getting information from the state. So those two things are helping. But there is sometimes a delay in that report. So you in the front line, our employees, our professors, sometimes are the first people that they will contact before they even call us. So it's critical that you let us know so that we can take early action. Because as you know, early action is important here, right? I want you all to know that just because we have a number of cases, it doesn't mean we are laxed or we are not engaging. And we certainly have many stories we can tell you about students who both were very willing and happy to, be relocated and follow our plans, and some who weren't. And those who were not, we are dealing with them. We do everything we can to get our students to come forward and help and be a part of the solution. And the students that aren't, believe me, they are being dealt with. There is no shortage there. And trust me, people are more than willing to let us know when they think someone is not doing what they should be doing. So the pipelines to get that information are good. I certainly know, and I'm not naive. I do understand that there are people that will try to buck a system or not be willing to work with us. But by and large, I can tell you, we have been following up and getting good information and really trying to stick with the policies and protocols we put in place. So please help us with that line of communication.
Scott, there's a question about if somebody has a student who was exposed and tested, should they also be tested?
So what you're referring to is very, very common. So Annette and I've had numerous conversations about this in the public health world. So what you're referring to is they are a contact of a contact. So the risk of a contact scenario is incredibly low. The infectious period, the incubation period, is somewhere between 2 and 14 days. If someone was exposed to someone, it's not likely that they're now exposing others. That's why we want to get that exposed person to quarantine as quickly as we can. I'm not going to ever tell anyone don't get tested, because I don't think that's right for me to tell someone not to do that. I can give you recommendations based on public health guidance, and all of that guidance is honestly available online. If you go to the state health website, you can find out all the recommended guidance that I and my contact investigators have been trained to follow. So that information's out there. But if you feel at any point, as any of our employees feel like you should be tested, then you certainly can do that. And those opportunities are there. If you go to covid19.nj.gov, you'll be able to see the areas that you could get tested locally. Just type in your zip code. So that can happen. Like I mentioned before, if you choose to get tested at Hollybush, you can go through Rowan Medicine. If you call the Washington Township office, they'll facilitate getting a rec. and we can collect that specimen for you. The other thing I'm happy to report is that Rowan University is also supporting the Gloucester County Health Department in a drive-through testing program, just like we did back in April and May when we ran that program. So that's starting next week. So that'll be another opportunity for us to refer people to get tested there. That'll be in Clayton. So there's lots of opportunities to get tested. The public health recommendation in your question, Joanne, is not to be tested and to just monitor your symptoms and be safe and follow the public health guidance that we are giving everybody about distancing and hand washing and masking.
Mm-hmm. Thank you.
Yep.
There was a question about the number of asymptomatic students that are being tested per day. Can you speak to that number and any efforts you're making in that area?
Yeah, sure. So the asymptomatic surveillance program is a weekly program. So once a week, I have what I affectionately call my spit squad of interns that are helping me run that program. And we are emailing students over the weekend to solicit their participation. We've incentivized with a Barnes & Noble gift card. So that happens usually every Tuesday at the Hollybush Mansion to collect that. So that's a weekly practice, not a daily practice.
Thank you. And I'm sorry, the questions keep going all the way back to the top and I have to scroll all the way down, so forgive me. There was a question about those who come in from out of state and what the protocol is for them. If they're asymptomatic, can they be on campus?
Yes, we actually, before the semester started, we went through every student who was registered for 1 credit or more and identified the number was about 500, a little over 500 students who were listed from the out of states, the states outside where the governor had identified as needing to quarantine. We contacted them. We actually did a series of 2 surveys with them, and based upon the answers that they gave us, we ran their quarantine process. So a vast majority of those did their quarantines before classes even started, and so I think we're in good shape with that process. You know, the challenge, as Scott will tell you and others will tell you, is that changed on a weekly basis. So Delaware's a great example. It was on the list, off the list, on the list, but I think we managed very well to work with those students and let them know what they needed to do before coming to campus.
There's a question about flu shots, Scott.
I was actually just going to text you to say, hey, don't let me forget flu shots. So yes, flu shots are happening on all of our campuses. We are working collectively to make sure we have some outdoor flu shot opportunities for everyone on both the Stratford and CMSRU and on campus. I can tell you our plan is October 15th. We are going to hold a mega drive-through flu clinic. First time I'm doing drive-through here on our campus. I used to run drive-through flu clinics for the county back 10 years ago. And the county is going to support us with that as well. Our local ShopRite pharmacy will also be there. So we will hopefully shoot as many as 1,000 at the Tech Park on October 15th. And then we're going to hold a series of number outdoor clinics to follow. So yes, we will have flu opportunities. I strongly recommend everyone to get the flu, depending on what news is your preferred news, whether there's going to be a horrible flu season or a light flu season. Regardless, recommending a flu shot is never a bad idea.
Joanne, may I add to this? May I add some information? So I agree wholeheartedly. This is the year to be sure that you get your flu vaccine. The injectable form is an inactivated vaccine. You cannot get the flu from the vaccine. So I just want to emphasize that. Many people, there's a myth. They say, oh, I got the vaccine a couple of years ago and I got the flu. You cannot get it from the inactivated injectable vaccine. This is a very important public health message for this season with the possible convergence of another surge with COVID and influenza hitting at the same time. So please do get your flu vaccines.
Thank you, Annette. Scott, there's a couple of questions still about asymptomatic student testing. And can you tell us the number of tests that you're doing?
Well, today we're collecting 42, which is roughly 1% of the residential population. So our goal is next week we're going to double that, and we're going to offer it to off campus. So we are going to be expanding that program. So hopefully I'll be doing closer to 100 a week. That's the plan. Yep.
So there are some questions about it. Is there a definitive marker by which we would make a decision to, send people home from the dorms, or to have all classes go remote, even though most of them are already remote? That's really a two-part question. I don't know, Scott, if you want to start it, and Tony, you want to finish?
Yeah, sure thing. So I mentioned the metrics in the metrics meeting. Those are what's driving the decisions, the data. It's what we're seeing. But I think I'll just speak in general. It's what we can handle and how we can safely handle the burden of disease on campus. This is central to our plan, is being able to keep students on campus via triad to maintain this. So we're not sending students home and then propagating the infection. So I could tell you our isolation resources on campus are intact and strong. I'm still able to perform tests on campus. All those things are happening, and we're keeping our employees and the most vulnerable safe, which is number one. That was one of our driving decisions to maintain operations as is. So that's the heart of our plan, is flexibility and protecting the most vulnerable.
Thank you. Tony, you want to add anything?
And I think, I don't think we have concrete numbers on one specific category in mind. I think it's a collection of the data that drives our decision-making process. Again, we've talked about this. We've been planning for this fall for a long time in ways that we've never had to do it in before, and our plan is based on flexibility. We watched other universities that started earlier go through different iterations of start, stop, start, pause, and return with success. So we're gonna continue to monitor and make decisions as public health dictates. I think one of the things that is central to our plan, though, is any changes would happen in stages. We may go all remote. We may limit activities if public health dictates. But you're seeing the evidence is telling us right now the safest place for students and the safest place for our communities is keeping these students that are now on our dorms, on our campus, in a cohort in those dorms. It's safer for them because if the outbreaks come, they have access to food, they have access to the hospital system, and they have access to technology for their classes. If something were to happen in massive outbreaks and we have to send them home, we could be sending them out to communities to start spreading the virus. So we've got a staged plan on how things would go if cases start to grow past where we're comfortable. And we would.
Right now, correct?
There is no concern right now.
Okay. There is a question about drive-through flu tests and people without cars. So you're doing many other events for flu tests for students as well, correct?
You talk about flu shots, you mean? Yes.
Flu shots, sorry.
Yep. So I wanted to do a drive-through because we know the COVID vaccine is going to be coming at some point. So we want to demonstrate that we are able to do this. I know we can do it safely. It's built-in social distancing. So we're definitely doing a mega drive-through, but we're going to have multiple walk-up clinics outdoors as well.
Mm-hmm. There was a very specific question. Again, it just went all the way back to the top, so forgive me. I apologize if this has been answered. If a student has reported that they have tested positive, but we have
I just wrote an answer to that one. Always, if you hear, report. I don't care if you want to report it to the Provost's office, Kevin and Scott. We would rather hear about a positive case multiple times where we can actually take action than not hear about something until it's too late. So if you have a question, please report it.
And just to be clear, they should forward that email or put it in an email and send it to whom? To Kevin or to the Wellness Center?
Wellness Center, myself, both. And again, as Scott had said, that's really an important piece because there is a delay in information sometimes, and oftentimes the faculty member is going to be that first point of contact. So that can come to me, Dean of Students. It can come to Koett at Rowan. It can go to the Wellness Center. Whatever's easiest for the faculty or staff member to report, we want them to share.
Thank you. Are the students in Triad who are quarantined there being tested regularly?
No. So any student that's in isolation is not being tested regularly. They're already positive. You know, in fact, it's a good time for me to talk about some of the different testing measures that are out there. So there's rapid tests, there's PCR tests, there's antigen tests, there's new tests coming to market. I know that there's a new Binex test that Abbott's putting out, and we are looking into procuring that as well. There's wide variability. The state health department is very, very interested in us collecting this data because they know that there's different efficacy, there's different sensitivity to these different types of tests. And there's actually different tests that are better for others. A rapid test is better if you are symptomatic. So it's problematic, but I can tell you we are following the public health guidance. So regardless of the type of test you get, any student that's positive, we are following the public health guidance, which is to isolate and quarantine. So that's happening. We are not continuously testing, nor do we recommend, nor does public health recommend continuously testing someone who's positive. Our students have to be in isolation or quarantine for the recommended period, and I've increased this is not public health guidance. Public health is 1 day symptom-free. I'm saying anyone related to COVID is to be 3 days symptom-free before we allow them to participate in activities. So we are going above and beyond the public health recommendations for that. Public health does not recommend retesting someone to end a quarantine or isolation period.
Thank you. And can you please define isolation and quarantine again?
Sure. Isolation is for any student who is a known confirmed case or a presumptive case. So if we're treating them clinically, for example, no test is 100%, nor should it be an amulet that anyone wears around their neck that says they're protected. Testing is just a tool that we use in healthcare, right, to help us with our diagnosis and determine treatment. The treatment in this case is isolation and quarantine. So a person who's isolated is someone who has been known to have the infection. We are keeping them typically 10 days from the onset of symptoms or 10 days from the test, whichever is most appropriate. Someone who's in quarantine is typically in quarantine for 14 days. So 14 days from their last known exposure, right? So that is different, and hopefully that person never becomes positive. Many students that we have in quarantine are also getting tested. And again, I'm not telling anybody not to get tested, but that will not change the outcome. Most people believe if they get a test and it's negative, they can now walk around and do anything. That's why we're not recommending that. The treatment is to isolate or quarantine. That is the treatment. I'll keep saying that.
Thank you.
Joanne, can I add to that? I have a very simple way to remember isolation and quarantine. Isolation is for someone who has the disease. Whether they're symptomatic or asymptomatic, you isolate them because they have that disease. Quarantine is for the person who has been exposed or is a close contact of someone with the disease, but they don't have the disease. So that's my simple way to remember.
Thank you. I appreciate it. For Kevin, any plans on extending outdoor activities? Students are reporting that there's a increase for them outdoors.
Yeah, and I think that's a fair question. We certainly are looking right now to develop a plan for the rec center. The governor recently extended some opportunities for the rec center, so we're looking at that. We want to make sure that we have the staffing, and B, that we have the ability to appropriately socially distance. Again, there are a number of activities that are happening in person, virtually, but we know that we've got to do more, and my team is certainly working on that and working on opportunities. So we'll see more coming here in the very near future.
Okay, thank you. Is there an employee testing program?
In terms of asymptomatic surveillance, we currently do not have an employee testing program. Employees are given the same resources that we give to students or anyone if they want to get tested on or off campus, but we do not have an asymptomatic testing program.
And there's another question here about the fact that we're testing 1% of students, and what is the CDC recommended level of testing?
There is no recommended level of testing for an asymptomatic surveillance program. We wanted to make sure that we were getting an assessment, a snapshot, because we know that there is asymptomatic transmission. So we created this program to do our best to provide some sentinel sentinel surveillance.
And there are a couple of questions here about employees, specifically about when they come back. I would encourage them to work with their supervisors, and they'll be able to help them come back and exactly how and what that's going to look like. So let me go through. We have 101 questions, so bear with us while we go through them. A lot of us are trying to answer them as we go along. There's a couple of reports here about people that think about what individuals have seen on campus. We'll certainly follow up with them. There's a question about having wipes out at the outdoor locations, the tents. And as you mentioned, Kevin, we will be getting more outdoor tents. In fact, we have a resolution on tomorrow's board meeting specifically for that. Let's see.
And I would just remind people while you're looking, Joanne, just remind people about the online form where they can report concerns. That helps us track and follow up on things. So please, that information is on my website. Please use that report form. That helps us as well.
Joanne, could I recommend we take the questions and because this last comment's a really good one. We take the questions and we try to provide answers to as many as we can.
Yes.
And publish those answers. Kind of we'll bundle them, you know, because one question I want Kevin, could you answer this question? Because I saw it come up a couple times about our dining. Can people dine inside? Can they eat?
Yeah, most of the dining is
just about to do that.
Okay, good.
Sorry, yeah, most of the dining is grab and go and eating outside, but there certainly are opportunities in Holly Point to make reservations. That's certainly on a limited basis based upon the capacity. Certainly as we move into other phases, governor's talked about phase 3, et cetera. As we move, we will open up what we can. But the Holly Point is on a reservation basis, limited basis. Most of it is outdoor.
So there are recommendations here, more sanitizing stations and some other things. We'll certainly take a look at that as well. Kevin, can you talk a little bit about where the additional tents will go? And yes, we are planning on getting heaters as well for those, just so everyone knows.
So there are a number of areas. Obviously, Joe Campbell's been more involved with that, but that we're looking at some areas behind, adding behind the student center. We're looking at adding over by engineering hall, the engineering building. We have actually had a conversation about adding a tent over at Triad to give students there an opportunity to sit outside if they wish. There's been some conversation about adding a tent to the front of the student center. So there are a number of areas that we're looking at. Joe Campbell and his team have done a great job of assessing the campus and trying to find areas. And as you've said, we're looking at adding heaters. We're looking at the opportunity to make these year round and not just temporary for quote unquote good weather.
Yes, and we will. We're also looking at having one in front of the Welcome Center on Rowan Boulevard. And just so that everybody knows, the borough is planning on keeping Rowan Boulevard closed down for the long term. So that's good news. So we have those as additional places where our students can gather. So, okay. So we've answered a lot of the 107 questions. If we did not get to your question, please feel free again to email us directly. We do hope that this has been helpful. And certainly we'll be working to address a lot of these questions if we did not get to them. On the website, which we do encourage you to visit often, and to know, please, that we're working with the Office of the Secretary of Higher Education, who has been providing us with very clear guidelines, as well as the Department of Health. So thank you, everybody, for being here today. We do plan to have periodic updates like this so that we can continue to update you on the plans and where we are as a university. We appreciate your questions. We appreciate you being here. And we appreciate all that you're doing for the students and for the employees and the Glassboro community. Just again, a reminder that we'll be doing a similar update in partnership with the Glassboro leadership tomorrow at 7 o'clock. And that's for the neighbors who, also have a lot of questions, understandably. And so we're working very closely with them to help address their concerns. And then we're doing another one on Thursday at 4 p.m. specifically for students. So this one is for employees. Tomorrow is for the Glassboro community. And then Thursday is for the students. So we are doing our best to get as much information out there as possible. As a reminder, this is recorded, so you'll be able to go ahead and take a look back at it if you'd like. So once again, we thank you all for everything that you're doing, and we hope that you and your family stay safe. Thanks for being here, everybody. Take care.